Without objection, the gentleman is recognized for 5 minutes. Without objection, so ordered.
Mr. Speaker, those who are watching this today may wonder what just happened in the House of Representatives, and I want to talk a little bit about it so they understand what goes on next week on the floor of this House. Today we set the stage for the passage of the Republican health care plan. It won't be a repeal of what the Democratic Congress did before. It will be returning us to the status quo when we are totally in control. The health care insurance in this country is totally in control of the private insurance industry. Now, yesterday I was on a conference call with groups that represent 18,000 physicians who want us not to act and repeal the Affordable Health Care Act next week. They've taken resolutions in every district around this country among physicians. They've delivered them to the Speaker's office, Mr. Boehner in Cincinnati. They've taken them to Mr. Cantor's office in Virginia because doctors know what this act really does. I listened to a couple of my colleagues who are physicians, and I heard them say they wanted to repeal it all. But the 18,000 physicians who I was talking to, or their representatives, on the phone yesterday were talking about what the real experience is out in the doctor's offices, not on the floor of the House or not in some political arena where we're making points, but when you're actually dealing with patients. And the reason the doctors want it, I am a physician. I've been there. I've done it also. I've had phone calls from Omaha, Nebraska about whether I could continue to see a patient. And every doctor who has practiced in this country in the last 30 years knows that's what goes on. They know that patients don't have health insurance because they have a pre-existing condition. They know that people who thought they had insurance suddenly get an illness and then find out their insurance company won't cover them because of some technicality or whatever they find. They worry about their own children who finish college at age 21 or 22 and can no longer be covered on their insurance policy. But with the bill that we passed last year, those young people can be covered from age 22 to 26 until they get a job where they have health care benefits. Those are the reasons why doctors want to see this bill stay in place and be enacted. Now, what we're going to see out here next week is political theater. I call it the sheep in wolf's clothing, or the wolf in sheep's clothing Follies Act of 2011. We have a piece of legislation which we were told about today. It is exactly 1 page long and repeals everything that happened. It repeals the prohibition against pre-existing condition exclusions. It allows people no longer to cover children over the age of 22. It sets lifetime limits again on people's insurance policies. All of that occurs here in one single piece of paper with no debate, no committee hearings, no effort to find out what's going on out there in the community. It's a political document for a political purpose for a part of the Republican Party. It is not what the American people are actually feeling. Now, what you will hear next week is even more interesting, because we're going to get a fraudulent piece of legislative hot air. They'll say, well, yes, we're repealing Obamacare. You know, it's strange. They never call Medicare Johnson Medicare. It passed under President Johnson. I wonder why not. Because it was for all Americans. It's not the president. It's the body that sits here that passes the legislation that covers all Americans. And yet, we are now next week going to be offered this piece of fraudulent hot air. It's House Resolution 9. They'll say, yes, we're repealing that, but we have this. And when you read H.R. 9, it's one page of nothing.
Time has expired.
Read it. You got the weekend. I yield back the balance of my time.
Thank you. The gentleman from Texas is recognized. For what purpose does the gentleman from California rise?